So I'd like to welcome Dr. Kyoon Achan, who will be presenting on the topic entitled Health Promotion Strategies to Improve Early Childhood Oral Health in Manitoba, First Nations and Métis Communities. Dr. Kyoon Achan is an associate researcher at the Children's Hospital Research Institute and qualitative researcher with Scaling Up of Healthy Smile, Happy Child. She's primarily interested in Indigenous and new immigrant health and social well-being, and she has worked extensively with Inuit, First Nations and Métis peoples and communities. And she's also an expert in qualitative research using Indigenous community-based and decolonizing research methods. So welcome, Dr. Kyoon Achan.
Okay, thanks, Daniela, for that introduction, and thank you all for joining the session. I think it's a pleasure to be speaking about Indigenous oral health promotion strategies on Orange T-shirt Day. So for those who didn't know, it is Orange T-shirt Day today. And wearing this T-shirt invites us all to stop and reflect on the Indian residential school system and its impact on Indigenous peoples and communities for over 100 years now. And in many ways, these peoples and communities are still grappling with the different effects, on them today. And probably the one place it shows up most prominently is in overall health and well-being, including oral health. But it is a good day to be thinking of ways to make things better. And one of those ways is to listen to Indigenous peoples and listen to Indigenous communities. And I think that is what that's what we have done through this study that I'll be sharing results on today. So health promotion strategies to improve early childhood oral health in Manitoba First Nations and Métis communities is the title that you got. But I also wanted to point out this title here that's it's the same thing, it's just a little different. This says early childhood oral health promotion with Manitoba First Nations and Métis communities, because we have a publication in press and this is how it's worded. And that publication will be coming out in the Public Health Agency of Canada Journal. The journal is called Health Promotion and Chronic Disease Prevention in Canada. And I think that article will be published in the January 2021 edition. So look out for that. I'm also presenting on behalf of a large team. You can see everybody's names on there, and some of those people are in the session today, and I invite them to jump in and make comments, or just maybe respond to some of your questions, some of the questions that people may have at the end there. But we're presenting results from a study that was conducted with urban and rural First Nations and Métis communities back in 2018. And we're at that place now where we can share some of the results, and we're starting to implement some of those too. So I'll have somebody, Melina, at the end who will share some of the ways that we're implementing this data. So the background to the study is that early childhood caries rates are on the rise in Canada. That much I think most people know. Dental surgeries to treat ECCs in children 12 to 59 months of age account for 31% of all day surgeries performed on this age group in Canada. And total hospital costs, hospital-associated costs as of 2016, when the study you see over to the right was published, was over 21 million. And this is 4 years down the line, and we think those rates and the numbers, would be higher at this point. So our goal is to find ways to prevent early childhood caries, and sometimes I'll be saying ECCs, because that's the abbreviated. That's the abbreviation. But for those who don't know, early childhood caries is decay in primary teeth in children up to 72 months. And this is a disease that is common in children from low-income households. It does happen in high-income households too, but you know, it's more prevalent in low-income households. So newcomer families, refugee families, people who live in rural and remote regions of Canada. And that, of course, would include First Nations, Métis, and Inuit populations. The Indigenous populations, though, frequently experience a more severe form of the disease called severe early childhood caries, so SECC. And if you look at the photos there, and you can see a progression of that disease, and maybe the child on the bottom would be the ECC. But the disease poses increased risk of decay through childhood, adolescence, and sometimes, you know, all the way into adulthood, and can have some pretty serious effects on health and well-being. So our study position is that with evidence of severe early childhood caries in Indigenous populations, it makes sense that this population is therefore a priority population for promoting oral health and in fact, overall health and well-being. And where best to go to find out how best to do this than to go to the people concerned themselves, right? So our position as Indigenous parents and communities are in the best position to know and articulate what would work for parents and for the communities, you know, for promoting oral health. So the Healthy Smile Happy Child initiative takes a community development approach to improving the overall health and well-being of young children in Manitoba, including First Nations and Métis children. And they developed an implementation research partnership to understand factors affecting oral health in preschool children in Manitoba. And from what they learned, to scale up oral health promotion in First Nation and Métis communities. And this study grew out of that scaling up process. So the scale up study, it's called. And its aim is to understand barriers faced by you know, young children in First Nation and Métis communities, and to use that information. So our Indigenous partners for the study were Nananda Wawegamig, the First Nations Health and Social Secretariat of Manitoba. We had the Manitoba Métis Federation on board, as well as the First Nations and Métis communities who participated in the study. And the purpose was to understand, amongst other things, of course, but to understand where and how First Nations and Métis families and parents learn to take care of children's teeth, because you get that knowledge at the source, or you find out where people learn from, and we can partner with the people or the places where they learn from to increase information that would go to parents, but also maybe increase accuracy of the information that should go to parents. We also wanted to know what some of the best ways would be to provide caregivers and communities with early childhood oral health information so that we could improve uptake and encourage the actions that reduce early childhood caries. So we took a community-based participatory approach to engage First Nation and Métis communities, those who participated. And this means that the communities, partners and communities were a part of designing and implementing the study. And in that way have access to all information readily in real time, as well as to the data that is presented to partners and the community in various formats, you know, that they can use. We got ethics approval from the University of Manitoba Human Research Ethics Board and the First Nations Health Information Research Governance Committee, and that's at the First Nations Health and Social Secretariat of Manitoba. We also got approval from the Manitoba Métis Federation and had those partners at the table. and in all meetings, actually. So participants were recruited through community-based oral health promoters. These are people who live in those communities or have really close ties with the communities, and basically know who to reach and how to reach people, and could bring the community out to the focus groups. Participation, though, was voluntary, and it was open to all community members. So it didn't just have to be parents, everyone was welcome to come into the focus groups or sharing circles and provide feedback. And we got written informed consent from all participants. So we had focus groups and sharing circles. We had 8 in total. 4 were rural, and 4 were urban. 2 comprised primarily of First Nation participants. 2 were primarily of Métis participants, and 4 were mixed First Nation and Métis participants. So the mixed groups were the urban groups. So those took place here in Winnipeg. And the 2 First Nation groups and 2 Métis groups were rural, and were conducted in the communities. So overall, we had 59 people participate. All responses were audio recorded and transcribed verbatim for thematic analysis using NVivo 12 software. And so the analysis was thematic, and we were looking for converging First Nation and Métis responses, but First Nation or Métis identity is indicated throughout to maintain distinction of thought, because we weren't looking to melt First Nation views into Métis views, but we looked for where they agreed. So there were 11 focus groups questions in total, and for this presentation and the article that is now in press, we addressed only 3 that were specific to health promotion, oral health promotion strategies. And those were questions 5, 6, and 10 highlighted, as you can see. So question 5 asked, well, where did you learn about baby teeth and how to take care of them? So we wanted to know what or who influenced what participants know about taking care of babies' teeth. And we also wanted to know if they found those resources respectful of culture and traditions. For question 6, we asked, well, what do you think are the best ways to get important information and tips to parents and families to keep kids' teeth cavity free and avoid getting serious tooth decay? And so to prompt people, we asked if there were any particular places where they would like to see more information about children's dental health, and where, but also from whom. But this was more focused on how to reach the community, right? So to reach parents and families in the community as a whole. And then in question 10, we asked, what is the best way to get oral health information across to you? And here we were speaking specifically to parents and caregivers who were in the room, just kind of inviting them to reflect on, what the best ways would be to reach them as parents and caregivers, not just the whole community. So characteristics of the participants: First Nation, they were First Nation and Métis parents. There were grandparents that came out to the groups. There were aunties, there were friends. But basically, most of them, had children or knew people who had children under 72 months. So about 55% of all participants were not employed at the time. About 50% had less than high school education, and 88% had at least one child. And here's a summary of the results. So I've separated the columns into strategies for reaching First Nations and Métis communities with early childhood oral health information, as well as reaching parents in particular. So on the community side, They wanted enticing oral health care products or oral hygiene products. They wanted dentists and doctors instructions. They wanted information provided at community health fairs, because that's a good way to reach a lot of people. They wanted information placed at specific locations in the community where people are likely to go and see that information. And they wanted oral health information marketing. On reaching parents and families, some of the themes were, making sure information is culturally appropriate and communicated in the local languages where possible. They wanted accessible oral health programs, books on oral health care. They wanted collaboration with already existing community programs. They wanted home visits for hands-on teaching. They wanted information sheets and visual teaching aids. They wanted oral hygiene products provided to parents and families who may not have those or not be able to afford those. And they wanted, some of this work done through primary care providers, because those would be their first contact with any health issues. And they thought working with schools and daycare centers would be a good idea, and social media. So to the question, where did you learn about baby teeth and how to take care of them? Some of the themes were culture. People learning from the culture practices that are already in place, that are passed down to them. People learn from parents and other family members. People learn from dentists and primary care sources. People learn from schools and daycare centers, and from prenatal and postnatal programs, and from online and print sources. And I have that one quote on the bottom there, where a First Nation participant said, "I use traditional medicines for teething. It helped soothe the gums," as he, referring to the child, was going through teething. So when people use things that work, as a parent, it becomes your go-to. You keep going back there to use what works. And these are additional quotes to speaking to this question: where did parents learn about baby teeth and how to take care of them? So a mixed group participant said, "I was in the hospital. When I was breastfeeding, I learned from the nurse. And then I also had a public health nurse visit me at home, and she talked about early childhood oral health." And a Métis participant saying, "Well, when I was going to school, they," referring to dental hygienists, "used to come in. We used to have the dental hygienists come and clean our teeth. They used to do the fluoride at school, but they stopped those." And another mixed group participant saying, "Well, just seeing these posters around, like daycares and at the school." So people actually do look at resources that are available. So I should say I'll be, I really want you to hear the communities. So I'll be going through and sharing just a lot of these quotes, so you can almost follow directly what the people were saying. So now, specific to this question, what do you think are the best ways to get important information and tips to parents and families to keep kids' teeth cavity-free and avoid getting serious tooth decay? How to reach the community, basically. I'll let the quote speak. So they had talked about having enticing toothbrushes and toothpaste. Well, there's and we have two mixed group participant quotes here, where one says, "My daughter, she loves brushing her teeth. We have to buy her a certain kind of toothpaste with ponies on it. She's really a girly girl, so it really helped with the toothpaste. It is my little pony on her toothbrush. I think it's what's on the toothpaste. Like, she'll brush her teeth more often. And my third child, he uses a Ninja Turtle toothbrush." And the other quote, "My girls also didn't like mint, any mint. And it took me a while to be like, come on, girls, we've got to do this. And they would be like, I hate brushing my teeth. But I got them the strawberry stuff that is both toothpaste and mouth wash. And ever since then, they're like, oh, this is pink. And it gets them to brush. So participants also valued advice that would come from dentists and doctors as something that really helps them want to adopt those behaviors to support early childhood oral health. And this one quote here from a mixed group participant said, well, I think the best way also is to get the doctors more informed too. Because when you're pregnant, that's when you're trying to get all the information. And people need all that information then. So doctors, well, make sure you're talking about, speaking to doctors, well, make sure you're talking about baby teeth and bring up the dentist. So I think there was a sense here that if doctors and dentists, were involved with moms early on when they're pregnant and just really looking for all of that information to prepare to take care of their babies, that parents and moms in particular would be more likely to use that information at the time. But I think it's also important that they mention doctors, right? So most pregnant moms, I guess, wouldn't be going to the dentists at that point to seek out information about the baby's teeth, but they'd likely go to the doctor. So just to have the doctor there too, bringing up the dentist and oral health. And a Métis participant saying, if the dentist tells him that he's got to do something, he'll come home and he'll do it. And he'll tell me, this is what the dentist told me to do, referring to her child. So just having that advice from dentists and doctors being really useful. Participants also talked about having booths at events and health fairs as a great way to reach the community, because usually the community would go out to these health fairs and events, and be open to receiving information that was available to them. So we have a First Nation participant saying health fairs to have your booths and give out brushes. We have a yearly health fair where we do that, but the whole community does not participate. So even if it's not everybody, it's a lot of people who go out there, and setting up booths at those health fairs would be useful. And mixed group participants saying, well, you could go to the neighborhood barbecues, like meet the parents and staff, go there and be like, here, this is our program. Here's a toothbrush and a toothpaste, as a friendly thing, and not be like, here, take it. Just so you know, when I was a kid, I loved bringing toothbrushes home. So just having different open community ways to connect with parents. And a third quote saying, well, I think also getting kids involved. Like you said, you mostly reach like parents when we go to festivals. I have the screen in the way there and I couldn't even fully read that quote, so I have to look for it here. Okay, so I think also getting kids involved, like you said, you mostly reach like a parent or parents. We go to festivals for the kids, so we have games we participate in, but we also take part in different activities. So making early childhood oral health information available in centers in the community was also pointed to, with a First Nations participant quote here saying, well, I think another way would probably be to go to the school, go to the daycares, show the kids the pictures of rotten teeth they were referring to, because you'll shock them when you show the teeth. And I think that would probably be good. And Métis participant saying, when I was in elementary school, the dentist would set up one of those booths and then parents would have that source of information, basically. And another First Nation participant saying, well, I'd say that if there's something happening in the community, set up a booth. Visual is always better than paper. Having it on paper for myself, they gave me all the information. I knew that I could read it, but I chose not to until they came along with the baby bottle showing me how much sugar is in an apple juice, how much sugar is in a pop. Then I was like, holy, now that's not going to happen. So visual is better than paper. So just again, this enforces the previous point made about connecting with the community at large events, you know, setting up booths, you know, having visuals that people can see, you know, like this parent points to really just seeing how much sugar, putting actual sugar cubes in bottles, and just how powerful that visual was for her. And then marketing and social media. We have this Métis participant say, I learned some lessons from the food industry, how they saturate everywhere using messages. I think the government is the one that has the money to focus on that. I think we need to focus on getting early childhood oral health messages everywhere. Social media is better because it's relatively cheap. Get it over and over again, like from the food industry where you're constantly exposed to foods all the time. You need to get the dental messages in the same kind of volume. So we have to think outside the box. And this is a great example for one way to think outside the box, to just really market that oral health information out there, so a lot of people can't avoid seeing it or hearing it. And a First Nation participant basically echoed that, and when they said, well, the same scope of thinking like they do with cigarettes, they should put warning labels on candy bars. So you know how you get a pack of cigarettes and it has and or dealing with illnesses. They thought if you put that on candy packs so people see that they can their teeth could be affected, that might be a useful thing. So that was that on how to reach communities. And now to the question, what is the best way to get oral health information across the First Nation and Métis parents? They had these to say. So the first thing probably was to make sure information was provided in a way that people sitting in their cultures could hear and understand it. And I'll read the second quote there. It says, I think you should have like a brochure that has certain languages on how to take care of a child's teeth, or someone who can talk to caregivers or parents in to caregivers, or anyways, a person that knows about teeth and can talk to them in their language if they can't understand English. Some people just refuse to want to take care of the child's teeth, maybe because of religion or culture, and it would make sense to have somebody who knows that religion and culture to be able to relay that information in a way that leaves people open to receiving it, rather than people setting up mental blocks, you know, because they might feel that person does not understand their culture or understands the religion or even understand unique experiences of the community. So parents also wanted accessible oral health programs. And that's reflected in this First Nation participant's quote that says, I think that oral health programs should be made more open for everybody. Every child that's 4 or 3 years old in the community, give them oral hygiene products, not just because they're in your program. and, I guess give them the information to go along with it. This kind of speaks to programs sometimes being siloed in First Nations communities, where unless you're kind of registered in that particular program, the worker in the program may not see you as being eligible to receive the toothbrushes or toothpastes. I mean, even if that parent needs it. So this this suggestion here is to make programs more open in the community. So if you see families who have needs, parents who have needs, to provide them the information you have and give them the supplies that you might have, whether or not they're in your program. And the Métis participant quote said, well, anything free really for parents is pretty awesome. I'm a full-time stay-at-home mom with her 2 girls. Participants also wanted books that have the modules and activities on how to care for baby's teeth and when to care for baby's teeth, because parents will read them. And a mixed group participant just echoed that and saying, yes, books, kids' books in the mail every month. And some of these things might be readily available for the mainstream population, but you have to understand sometimes these sorts of resources are just not available in the communities at all. So when people ask for books, it's, they don't have them. So collaborating with programs in the community, these are fairly long quotes, but are really good ones. And I'll just read the first mixed group participants quote. It says, prenatal programs are a really good way to inform parents about what they can do in trying to help the children, because that's where it starts. We moms are the ones that are responsible for these kids, but it needs to be something that doesn't seem like work. That's something that's enjoyable, that gets us engaged. So they were referring to oral health promoters and said oral health promoters can send a couple of people once every 2 months just to come to a program like this, and we can play dental bingo or something. Those are the types of things, and we learn as we're doing it. I don't know if that's the only game to play, but so just really collaborating with programs that are already there and reaching out to parents, but also disseminating information in ways that are fun and easy for parents to follow and learn from. And another mixed group participant there said, well, Wiggle Giggle Munch, it's a program for parents with, and I'm not putting in a plug for that program at all, just reading a quote, but Wiggle Giggle Munch, it's a program for parents with kids about 1. It's a program where you do arts and crafts and stuff, but if you could maybe reach out to one of the people that run it and they can help. They give away something every day for every time we go. This week, we were given new toothbrushes, toothpaste, and pamphlets, stuff like that with contact information. Maybe have more resources you can use. Maybe have more resources you can use about teeth. Like, say, if people can't afford the dentist, put a list of 3 or more dentists on there, because it's so hard to research it. I've been trying to research, but the waiting lists are so long that by the time that'll happen, it just creates difficulty. But I guess the point here really is collaborating with programs that are already in the community, that are active, doing things in fun and engaging ways. And a Métis participant there said, well, baby programs, because they could help reach the younger moms. Parents also talked about home visits for hands-on teaching. So a First Nation participant said, well, I go into the house and I teach them. I show them or explain to them. I keep reading from my prints here because the screen's not showing up properly on my end. So I go into the house and I teach them, show them or explain to them whatever, but I know there's that, like they brush their teeth at the daycare, they brush their teeth at Head Start program, so I think it begins at home. And another saying, well, just talking to our parents, a one-on-one kind of thing. Some people would say like go online and that, but who really has time to go looking for stuff online? I think when you want parents to start taking care of their teeth, of their kids, it's better to have that one-on-one person contact, to have a direct link to that parent, or just to make sure the parents are informed. So having home visits or just looking for opportunities to engage with parents one-on-one. Information sheets and visual aids were thought to be important too. So sending home information packages to people who are expecting or have a new child, and then updating that information for older kids too. Mailing out a newsletter was also pointed out, and then having meetings. Well, when they said meetings like this, it was actually the focus groups we had, but it felt like a workshop. So people were referring to having, one-on-one in-person workshops with parents, but also handing out brochures and other information. Parents also wanted oral hygiene supplies provided to them. Where this one person said, well, also, I think giving resources to the families, sometimes like, who has enough money to buy 10 kids toothbrushes that are $3 and they only get a welfare check that is $600. That means it has to last for the whole month. So it's basically, they have to take money from food to get toothbrushes. So sometimes parents will make the decision to choose food rather than have oral hygiene supplies. And then the second quote, they're saying, well, I'd say give them a toothbrush and toothpaste, hand them out. If I knew somebody, like as a friend, I would give them a toothbrush and toothpaste for their kids. Well, maybe if they come here and they want to know more about healthcare or more about the teeth, give them a toothbrush, toothpaste, and maybe a letter saying steps on how to brush their teeth. So not just information, but to actually make sure they have those toothbrushes and toothpastes that they can use. So parents also talked about, because remember they had said they learned about taking care of children's teeth from primary care sources. Well, working through those sources was also encouraged. Well, this one quote here says, public health nurses can check your baby's teeth. They stop by here real quick for a checkup. And like I said earlier, to give information packages out. So yeah, just making sure more people are getting the oral health information every once in a while. So public health nurses have been identified as a good way to get information out to parents, because most parents would be interfacing with public health nurses. And then schools and daycare centers, because some families did talk about their children still learning a lot about oral care in schools and daycare centers. And then social media, which is fast becoming the future. A mixed group participant said, I'd say Facebook media, like draw on their phones, make like bulletins and send down bulletins, and maybe more commercials for kids, like on their cartoon channels or whatever, if they're watching something. And it's true. I agree with this second quote completely. Everybody's on social media right now. So trying to find a way to implement all the information on there. So not just like a Google search, actually like media ads on Facebook, on Twitter and stuff like that. And, I am quite proud to say Healthy Smile Happy Child is quite active in doing this. And so I really like this quote, and I think it's one that is worth really highlighting for a lot of people to think about, where this participant said, I think more outreach if I saw someone more like me talking to me about teeth, I'd be more open to it, I guess, because lots of people have perfect teeth. And but I can relate better if you don't have perfect teeth like me. I have a calcium deficiency, so my teeth decay a lot faster than others. So basically, having people who understand where parents are coming from, what experiences are resulting in these high rates of early childhood caries would help, because they would just come from a place of a lot of empathy and compassion, even in sharing information. So so we think it's worth noting that a lack of access to oral health professionals, maybe I have to refer to my notes again because I can't see my screen fully. So a lack of access to oral health professionals may be resulting in community members seeking information from less reliable sources. Approaches that have been effective against early childhood caries in lower risk populations have not consistently translated into Indigenous communities. So it's necessary to tailor approaches that make sense on the ground in communities and that will work in those particular contexts, as we've heard the parents and other caregivers share through this study. It is also crucial to continue to incorporate cultural and traditional knowledge that and make it align with early childhood health promotion activities, because people can hear what is spoken through that cultural lens, but also in a language where they can understand. Cultural safety and appropriateness is particularly important for First Nations and Métis peoples in the light of quite a difficult history and a differential healthcare system too. So some of the things that would apply in cities and urban centers may not be available or translate in rural contexts. So being aware of a rural context in planning health promotion activities. So it's important to educate community oral health workers and both Indigenous and non-Indigenous healthcare practitioners on how to be culturally safe while working in communities. It's important to establish trusting relationships and facilitate culturally sensitive care. So, for example, when you go into communities, it might be useful to have an Indigenous person communicate that information to Indigenous families within that community context. It's also important to, rather than reinvent the wheel, share information through already existing community health programs, because there's a good chance that program would have built close relationships over time and can more easily connect with parents and caregivers that way. Those collaborations are highly encouraged. It's useful also to engage non-dental primary care providers, because they're the first point of contact in communities. So if you can't get through, it just makes common sense to connect with primary care providers who families will see anyways. It's also important to develop and distribute fun oral hygiene products, as we saw families say, well, their kids may not want to brush their teeth, for example, but they'll do it if it's the right flavor, the right color, or even the right character on the toothbrush or toothpaste. So in conclusion, First Nations and Métis communities, parents and caregivers suggest reducing, okay, hang on, I can't see my screen. So First Nations and Métis communities, parents and other caregivers suggest their suggestions on reducing early childhood caries point to the importance of implementing widely available approaches and resources in ways that encourage uptake in specific contexts. Keywords here being specific contexts. Not everything that works in cities, for example, will translate consistently. Indigenous populations also do not have access to services that the larger populations take for granted. So targeted and funded oral health promotion activities with Indigenous promoters at the fore will help close those gaps, because they will know what happens in the communities, what's available or not, or creative ways to get information across. And then social media may also be a useful way to send many people important early childhood information in reasonable time. And I'm aware that even communities that have not had good internet are getting that now. It's in the works. So turning attention to social media is the opportunity for the future. So that's our team. And thank you. We'll take questions.